Welcome back to this Health Tuesday on your Feel Good show. Now, today we're shedding light on a condition that's often misunderstood but also misdiagnosed or even dismissed as severe PMS, which we know is premenstrual stress. But we're going to get into PMDD, which is premenstrual dysphoric disorder. Now, while millions of women experience PMS, PMDD takes things to an entirely different level with debilitating physical and psychological symptoms that really can impact you so deeply on the daily. And joining us to really break it all down is Dr. Chanel Martinison, a medical doctor from Eno Health Medical Centers. Alongside her is Tamsin Udeman, who was diagnosed with PMDD and is now working to raise awareness and also foster support for others facing this condition. Ladies, welcome. Thank you for being here. I apologize for saying disease, but I mean, Tamsin, we'll talk about maybe it does feel like a disease sometimes in just a little bit. But Doc, let's get into this first. PMS versus PMDD. Often they get confused. Can you maybe distinguish the two for us and break it down?
Yeah, so premenstrual dysphoric disorder, PMDD, it is a severe mood disorder that affects mood and physical symptoms. It is actually listed on our DSM-5 criteria in psychiatry, where we can actually diagnose it. There's a criteria to follow, and I've created a little acronym for myself called SITE, S-I-T-E, to remember what exactly that is. So S stands for symptoms. So there are like 11 symptoms that women can go through, but you need to have at least 5 of them with a mood symptom like depressed mood or anxiety or irritability to actually be diagnosed with it. And then the I is for impact, so impairment on daily functioning, that needs to be there. If it causes severe distress in your work life and your family life, that's impairment, and the impact of it. T is the timing, which is very important. So it usually happens in the final week of the luteal phase of the menstrual cycle, which we can go into a little bit later. But then the symptoms resolve once you get the menses, which when you bleed. So that's the timing that's important. And then E is exclusion. So it is not caused by any other mental or medical condition. Wow. So that's SITE. That is how we diagnose it. So it is a completely severe mood disorder that women go through. It affects about 2 to 6% of women, compared to PMS, which is premenstrual syndrome, where you need to have at least one of the symptoms, and it is in a much milder state, and it doesn't affect impairment. And that occurs in 90% of menstruating women. So there's a big difference. So that's more common, and then the PMDD diagnosis will be less common.
I love that you've broken that down for us. I also love an acronym, SITE. I'll remember that forever. But let's talk about the diagnosis, because often it is misdiagnosed and women are just left helpless, knowing that they are struggling with something, but there's no help necessarily for it. So what goes wrong? Why is it often misdiagnosed?
So mental health in general is difficult, so for doctors and for patients. So to actually diagnose it, and for patients to actually come forward and say, I don't know what's wrong, like something is wrong, but they're not sure actually what to put their finger on it. So doctors rely heavily on history. So if we can get all the information out of the patient, that helps a lot. But some women don't even know their cycles. So it is even difficult to put it to it's actually premenstrual in the luteal phase when you're getting it. So it can look a lot like a normal mood disorder or another mood disorder like depression, severe depression, but it's about the timing. So a lot of doctors, I always ask my patients when they come with mood disorders, when was your last period? Do you know your cycle? Do you know how to calculate your menstrual cycle? Because that's the problem, because they don't actually know when it's happening. It's just happening. It feels like it's happening all the time. Like a disease. And
you need to work with data. Like, you need to know what's going on. Which brings me to you, Tamsin. Thank you so much for sharing your story. I know that it's helped so many other women and will continue to do so. But 2023 is where your official journey started with the diagnosis and the exploration of PMDD. Can you talk to me about that? Were you somebody that took down notes every time you had your period?
Well, I am a very structured human being.
Okay.
So yes, I always keep track of my cycle.
Yeah.
The end of 2022, I realized I kept getting low blood pressure, severe fatigue, and eventually ended up in hospital because I couldn't actually function. Ran all the tests, and this physician came to me. He said, I just need you to drink more coffee and eat more salt. I actually can't tell you. And okay, great. And I left, and I doubled up on the coffee. But then a few months later, April, I noticed before my cycle, like a week to 2 weeks before, my breast was so sore. I was nauseous. I didn't recognize myself. I felt states where I would go into my bedroom, lock my door. Bearing in mind, I had a 4-year-old at the time. And I would just rock myself because I didn't know what was going on. Hopelessness, doom. And And then I'd kind of get out of it again. And then it would go back, and it would back and forth. And eventually my family begged me to see someone. So I said, okay. They could see it wasn't me, if that makes sense.
Yeah.
Went to see someone, and it took about 2 months. And I said to him, Doc, I use all the tools, I do everything, but let my cycle be approaching and I'm a different person. And he went, do you track your cycle? I said, yes, of course, here's my app. And he went, I know exactly what's going on here. And he diagnosed me then and there.
Wow.
PMDD. I went home, I said, what is this? And there I Googled, and all 11 symptoms.
Oh my goodness.
My hair was standing up, and treatment started, and I realized it's time.
Yeah.
I'd never heard of it. How many other women are struggling like I was struggling?
Was there a sense of relief when you got there? Like, okay, I'm not going crazy.
Yes.
There is something, and is it diagnosable? Is it something that you can get medication for? Is it something you just have to manage it?
Yeah.
Okay.
Yeah. So I started my treatment, and it took about a month or two for the treatment to really settle in, and that's when the awareness project started, because I thought to myself, I feel like Tamsin again.
Right.
And I decided, be vulnerable and help people if you can.
Oh, I love that there's light at the end of the tunnel. I mean, Doc, when it comes to managing it, what are the first steps that one could even do?
So lifestyle is important. So like exercise, diet, those things play a big role, but there are medications actually that doctors can prescribe. Obviously, once the diagnosis is made, you do want to exclude any other clinical conditions. So you do the blood test, everything. If that's all normal and it's happening at the correct timing, then it would be diagnosed. There are medications like combined oral contraceptives that we can use. There's gonadotropin-releasing agonists that we can use. Antidepressants like selective serotonin inhibitors. And then there is also a link in with mood disorders or mood-regulating supplements. So magnesium, calcium, vitamin B6. So that would be something that the doctor might actually check as well. And then you can take the supplements as well.
I love this. Thank you for bringing some good news along with the education that we need. Yes, there is some light at the end of the tunnel. And the best part is that there's a part 2 of this conversation. So if you are struggling with PMDD or think that you might be, know somebody that might be, send your questions through, and we've got the experts as well as somebody that's advocating for your health sitting on our couch today. So don't go anywhere.
It's my feel-good breakfast show.
And just like that, you're back here on your Feel Good Breakfast Show. Good morning. It is a Health Tuesday, and we're discussing something incredibly important. We're continuing our conversation on premenstrual dysphoric disorder, otherwise known as PMDD, with our good doc, Dr. Chanel Martinison, as well as Tamsin Udeman. Now, while PMDD affects a significant number of women, awareness does really remain low, leaving many to suffer in silence. So we'll explore the impact of PMDD on mental health right now, also common misconceptions and what can be done to improve support and treatment options. Because yes, there is light at the end of the tunnel. Treatment is here. And we got to start with you again, Doc. When it comes to PMDD and mood disorders, now you have to kind of break that down, because some people might think it's one or the other or both. How exactly can you tell the difference? And can you just break that down for us?
Yeah. So it's always in the name, premenstrual. So it's when it's happening.
Okay.
And like I said earlier, it must resolve. So when you start to bleed, in the first few days of your period, the symptoms actually get better.
Okay.
Because the luteal phase is now ended. So
also, can you break that down? When is the luteal phase in your cycle?
Okay, so day 1 is menstruation, okay? So that's when you bleed. That's the first day of your cycle is when you're bleeding. So day 1, you've now bled today, that's day 1. So that usually goes like day 1 to day 5, or some women day 7. Then it will be the follicular phase. That's when the energy levels start to come back a little bit and you get a bit better. Then it's ovulation, so that's around the day 14. That's when the egg is ready to be fertilized, and if no intercourse happens and no fertilization happens, then you'll bleed. Then you get the menstruation. Then it's the luteal phase and then the menstruation. So luteal phase is the period just before your period. It's the time the week before, just before the period. And the symptoms with PMDD is heightened in that last final week of the luteal phase, and then they get better once you start to bleed, because then the hormones have actually settled down. So just to talk about the mood disorders, that's a big thing. So like I said, it must have a mood symptom, which is depression or anxiety or irritability, hopelessness, and then the symptoms do get better. where people get confused is that they think it's MDD, but it's actually PMDD because it's about when it's happening. So with MDD, major depressive disorder, that won't get better when you start to bleed. There is treatment for that as well. But in general, mood disorders have a stigma attached to it.
Yeah.
I mean, we are much better now at talking about it, but it's just identifying it and speaking to your doctor about it and going through, because you need to have at least, most of your cycles need to have had the PMDD symptoms.
Okay.
So at least 2 consecutive cycles would have had it, and then your doctor would, like with thumbs, and say, okay, this is PMDD.
Yeah.
Yeah.
I'm going to come back to you to ask about at what age you can actually properly diagnose this. But I do want to touch base with you, Tamsin, just kind of finding out on the real and vulnerable and emotional front. When, you're saying these things to your family members, how did they receive it? I mean, when it comes to mental health, it's often not taken that seriously.
I think, obviously, because they had asked me to seek help, they were interested in what the diagnosis was. But to try and explain it, you couldn't find the words, because how do you explain to someone, I feel like my life is falling apart for a week to 2 of a month,
Right.
and it's because of my cycle. Again, stigma, there's a stigma attached to menstrual cycles and to mental health. So I sat them down and I discussed it with them, but I think still the penny didn't really drop until I actually started my awareness project. I have an amazing support system,
Sure.
and all I did was communicate as well. I said, right, I'm in my luteal phase now. I am not coping. This is how I'm feeling. So if I am like this today, it's because these are my emotions. So communication played a very big role until this day.
Yeah.
Even though I'm on treatment, I still do get symptoms, but I communicated, and that way it just makes things so much easier.
100%.
And that's how. And they've now, they speak about it. I have met friends who said to me, "I've had this for years. I've been too ashamed to say." People that I've worked with, people that I've been friends with,
Sure.
I just didn't want to say anything.
My goodness. Can we talk about your awareness project, though? I know you're an advocate for this because you've experienced it, and you brought so much light to something that people often suffer in silence with. So tell me more about the support that you offer.
Okay, so basically what happened was I was on a run one day when I was in my happy phase, and I thought, no, I need to raise awareness. So I contacted a family member, and she's a counsellor, and she said, I'll be happy to go. I said, let's just create an Instagram page, let's start somewhere, and we'll navigate further.
Right.
So we started the page, and we obviously went into information, and we started with posts, and then I started with reels, and I started just really trying to get the word out there. This is how I ended up here. I've just approached people to be able to get the word out there, because it is something that there's little to no knowledge on it, and I think that's the frightening thing, is people you speak to have never heard of it. I'd never heard of it. So that's where the awareness came from, and we've actively just trying to get the information out there, and the support we offer. I mean, we've got coping mechanisms, how to recognize it in a loved one. So you might not have it, but your daughter could have it, your sister could have it, your cousin could have it, your wife could have it.
Sure.
And a lot of women have said to me, I have an analogy on my Instagram page, and a few of them said to me, I showed this to my husband, and the penny finally dropped, thank you. And these are women in other countries.
Sure.
So there was just a very powerful moment knowing I am actually helping, and that's all I want to do, is help women.
Oh, you absolutely are helping. Even you guys sitting here on the couch today, it's definitely helping somebody out there right now just to realize, okay, I'm not alone in the struggle. That often feels like I'm fighting, just solo. So, Doc, if you could give some advice to anybody that, like you said, the penny might be dropping right now. What can they do next?
Yeah. So I think it's firstly speaking about it more, so that when you speak to somebody, you actually, like you said, they actually recognize, oh, I've been going through this, but they didn't know how to put the words to it. So it's definitely, when you're experiencing it, speaking to your doctor about it. And then the first step would be to understand your body, your cycle, what's actually happening in your body. Because if you don't know that, then you're not going to be able to tell the doctor when it's happening. And that actually leads to then taking longer to be diagnosed. But I think just, being honest with yourself and opening up about it is okay. It's fine.
And the first step.
Yeah.
I love that. And then touching back on the question I had earlier, just about the age that you can actually diagnose. I started my menstruation super young at around 9 years old. So is that something you can look into, or is it somebody a little bit older?
It can happen in teenagers, so it can from a very early age, but it's usually more diagnosed in women in their mid-30s to 40s because they've had more periods, so more cycles. So they've actually been recognizing a trend because, like I said, it must happen in at least 2 consecutive cycles. So when they've noticed it more, that's when it actually gets diagnosed. I mean, I only found out that PMS was a real thing in medical school when I read my chapter on premenstrual tension. I was like,
whoa.
it wasn't just in my head. I mean, the hormones, the serotonin, the progesterone, all of that, it is happening. And it's not that it's not real. It's in your brain, but it's not just in your head. So it really is happening to some people, and it can actually impair their functioning. So I think just knowing what's going on in your body, and it can happen from a young age. So I think understanding where this is happening in your daily life, like Tamsin was taking notes. You can actually recognize it. So it can happen from young to older ladies.
I love that. Ladies, thank you so much for this. Absolutely great work that you're doing. And of course, Expresso fam, we have all the details of Eno Health, where Dr. Chanel's from, as well as Tamsin's details on our social pages. Go and check them out and make sure that you get the help that you need. Thank you so much, ladies.
Thank you so much.